Babies are expected to share the same room with their mothers or caregivers, but not the same beds. Babies, it's a big no-no for our babies to lie with their mothers on their bed, for the simple reason that they don't need to cover the head of the baby during sleep time. For us practicing in Nigeria, we do not have a registry for sudden infant death syndrome, and expectedly, it is not even captured among the causes of death in children. So this explains the reason why I want to throw some light about this. The cause of sudden infant death syndrome is really not known. Some babies have even died while being fed. We must differentiate between choking or asphyxiation, as we'll call it, medical professionals would call it, during feeding, from sudden infant death syndrome that occurs during feeding. One unique difference between them is that, good day, my friends. It's good to be back once again. I am your host, Dr. Poski Ensured. Today, I want to talk about a certain condition that occurs in children that is called sudden infant death syndrome. Have you seen a couple that lost a child and they rushed to the emergency unit in a hospital claiming and saying that they just found their child lifeless? Do you have a relation on somebody not even so distant telling you that he or she lost a child from an explained cause? The child was not sick. So that is what sudden infant death syndrome means. In some other literature, it is also called sudden, unexpected, or unexplained death syndrome. There are several causes of death or childhood deaths. This is one cause that is hardly spoken about. Sometimes it is also underreported. Yes, it is a global condition, but if you go through literature, we'll find reports about this incidents in places like North America, talking about United States of America, Canada. In Europe, some of the European countries report the incidents, for example, Scotland, Ireland, and we also have, in New Zealand, they have a registry. But for us practicing in Nigeria, we do not have a registry for sudden infant death syndrome. And expectedly, it is not even captured among the causes of death in children. So this explains the reason why I want to throw some light about this. So by definition, it is the death of a child who is less than 1 year of age, less than 12 months of age, in an otherwise healthy child. Majority of the babies who have been affected, who have died suddenly, are usually more of males than females. And in literature, we've also found this to be also common about in babies of Black American origin. Now, what is particularly unique about sudden infant death syndrome is that over 90% of the cases, these babies are found dead when they are sleeping. That is not to say that SIDS a baby cannot have SIDS when the baby is awake. In fact, there are some reports in literature that has it that some babies have even died while being fed. Now, but we must differentiate between choking or asphyxiation, as we'll call it, medical professionals would call it, during feeding, from sudden infant death syndrome that occurs during feeding. What is unique? One unique difference between them is that in aspiration pneumonitis or choking while feeding, there's sudden onset of difficulty with breathing. But in sudden infant death syndrome, baby just suddenly becomes pallid, flat, unresponsive, and before you know it, there's no life in the baby. And the parents will report, or the mothers or the caregiver will report that the baby just suddenly died. So as I said earlier, over 90% of the time, these babies are found dead while sleeping or when they're about to be picked up from the sleep state. The cause of sudden infant death syndrome is really not known, but medical professionals, pediatricians, or researchers suggest, however, that the cause is not unrelated to the fact that the part of the brain that is responsible for breathing, for the heart rate, or arousal from sleep may not be fully developed in these babies. So there's a strong association that undeveloped brain, the part of the brain that's responsible for breathing, heart rate or heartbeat of the child, or arousal from sleep may be undeveloped. So if that theory is correct, little wonder that babies who are born too soon, what do I mean? born too soon. These are babies that are born before 37 completed weeks of gestation. That is from conception to the time of birth. And to make it more understandable, babies who are born before 9 months after they are being conceived, they are the premature babies. So there's a theory that part of the prematurity, what accompanies the prematurity also is that, apart from the general prematurity or the immaturity of the general body, even the part of the brain is equally not matured. So we also know that babies who are low birth weight, who are classified as low birth weight, are also known to be more associated with suffering from this sudden infant death syndrome. What is it to be low birth weight? It is a baby that is born whose weight is less than 2,500 grams, or simply put, whose weight is less than 2.5 kilograms. Okay, so these babies are known to have a higher incidence or tendency for having sudden infant death syndrome. Other risk factors that have been implicated include maternal smoking. This includes mothers smoking before pregnancy, during pregnancy, and even after childbirth. So maternal pregnancy is a very strong association between, for causing sudden infant death syndrome. Now, researchers have also identified the relationship between a baby having a previous respiratory infection or cold prior to being declared, prior to having sudden infant death syndrome. What do I mean? So there's a strong association between having a cold, a common cold as it were. A common cold is the upper respiratory tract infection that affects babies. It's usually caused by viruses, and because they are caused by viruses, they are usually self-limiting. So babies who have upper respiratory tract infection will manifest with catarrh, that is runny nose. They may have a cough, they may sneeze, they may have a low fever, just small hotness of the body, and some of them may have weakness, and they may have a reduced appetite. So these are features of our respiratory tract infection. We are not talking about lower respiratory tract infection here. Lower respiratory tract infection is technically what is known as pneumonias. On another day, we'll talk about pneumonias. And children who typically have pneumonias may have some of the symptoms I've talked about, but there's usually accompanying chest pain, and they may have a higher fever. So there's a strong association that some children who may have had a respiratory infection some weeks before the incident occurred. So that is the role that respiratory infections, upper respiratory infections play in terms of the incidence of syndrome, of sudden infant death syndrome. Now, we also know that babies who are born to unmarried mothers of lower socioeconomic class have also been known to experience this SIDS. There, of course, the history of low ABGAR scores. Now, having a low ABGAR score means a baby who may have experienced some difficulty with sustaining some spontaneous respiration after delivery. Okay, so that has also been known to be an association, with a sudden infant death syndrome. Another important risk factor is a baby whose elder sibling has died from sudden infant death syndrome. So there is a 4 to 5-fold increased risk of a baby of a family dying from sudden infant death syndrome if an elder sibling has died in the past. So these are some of the major risk factors that we need to know and put into consideration, when we are discussing this topic. And I just also need to let us know that what is the age group? Yes, I defined it as the occurrence of sudden, unexpected, unexplained death in babies who are less than 1 year. We also need to exclude those babies who are less than 28 days of life and are sick. Those are not part of the population we are talking about. We are not talking about babies who are neonates, who are on admission because they are ill. We are talking about babies who are less than 1 year, who are apparently well, who do not have any illness, but are declared dead without, a known cause. I need to also emphasize here that majority of the babies that experience this sudden infant death syndrome, they are between above 1 month to 6 months. As a matter of fact, over 90% of the cases of SIDS occur between 1 to 6 months. And the peak incidence is between 2 to 4 months of life. So these are periods that everyone must be quite watchful, particularly when these risk factors are present in these babies. Now, what can we do to prevent this sudden infant death syndrome in our communities, in our society? We must focus on safe sleep practices. Safe sleep practices. So, what does that mean? Our babies, whenever we want to put them to sleep, must be laid on their back. Babies should never be laid in a prone position that is on their tummy when they are to be put to sleep, either when they want to have a quick nap during the day or at bedtime at night. Babies must be laid on their back. And the question may also arise, what if during sleep the baby turns over into the prone position? All you need to do is to take the baby back to the supine position, which is place the baby on his or her back. Now, we must also ensure that our babies, they sleep on firm, flat sleep surfaces. There's no room for rough or undulating surfaces. A firm, flat surface ensures that our babies are unlikely to experience sudden death during sleep. The sleep environment should also be clear. It should be clear from loose toys, from soft objects, fluffy parts, or blankets as much as possible. We should also remember the role of rooming in with the babies. Babies are expected to share the same room with their mothers or caregivers, but not the same beds. Babies, it's a big no-no for our babies to lie with their mothers on their bed, for the simple reason that sleep is a form of unconsciousness. It's a subtle form of unconsciousness. Some mothers may roll over and roll on top of their babies without knowing. And of course, what follows is suffocation, asphyxiation, and sudden death. So, whereas it is advised that babies should sleep in the same room in the first year of life, most importantly in the first 6 months of life, and of course can be extended to the first 1 year of life, they should sleep in the same room with their mothers or parents, but not on the same bed. We should, as much as possible, also discourage having these babies being exposed to smoke, whether cigarette smokes from the mothers or even second-hand smoke from their fathers or other members, in-house residents. That is another way of preventing sudden infant death syndrome. Well, we're also advised to avoid overheating the room or overheating the babies. Some researchers advise that there may be no need to cover the head of the baby during sleep time. Exclusive breastfeeding is always a thumbs up when we're talking about reducing infant mortality or deaths in children less than 1 year. So exclusive breastfeeding in the first 6 months of life, is also one notable preventive measure that's for sudden infant death syndrome. Giving our babies immunizations, we have childhood immunizations, compulsory shots that babies should take, when they are born, to prevent what we call vaccine preventable diseases. By extension, we also know from experience that when babies are fully immunized, the likelihood of sudden infant death syndrome also reduces. The essence of this video is to increase public awareness about this condition. And so that is also a preventive strategy in itself. This is one topic that is not so popular, not well known, not well researched as well, but is a significant cause or contributor to infant mortality. So this video is also expected to enlighten not just the general public. It's also important for public health physicians, for health professionals who are involved with maternal health as well as child health. This is something we must consider. All the risk factors I've talked about, all the preventive measures I've talked about may not be exclusive in their rights, but I know that I've focused on major aspects on this condition, and I've tried to enlighten us about the incidence and prevalence of this condition and the need for us to be watchful so that we will reduce the incidence to the barest minimum. Not to forget couples or families that may have suffered the loss of their infants from an unexplained cause. These couples, in fact, may be undergoing one of the worst moments of their life, and they also require being exposed to some level of support. They are encouraged to speak up. They are encouraged to see their mental health physicians. They are encouraged to speak to trusted friends, as well as, of course, they could also speak to a clergy person, who can provide some level of comfort. Ladies and gentlemen, it's been a pleasure talking about the sudden infant death syndrome, a phenomenon that is prevalent in our society, a phenomenon that has brought untold hardship to some families, a phenomenon that is contributing to infant mortality. The essence of this video, therefore, is to highlight its incidents so that we as health professionals, the public also is sensitized on what we can do to reduce the incident. Thank you for being with me. Until we meet another day, it has been nice having you. Don't forget to like or share my content, as well as to subscribe to my channel, Dr. Polsky Ensured. Do have a great day. Bye.